Welcome to the 2025 Senior Rally Day. My name is John Pointer, and I'm the chair of the Joint Rules Committee, the California Senior Legislature, and I will be your master of ceremonies for today's event. Our theme today is empowering aging Californians during challenging times. Today's event brings together stakeholders in the aging community to provide attendees with their perspective on the status of key programs at the federal and state levels that have an impact on the lives of older adults in California. Our goal is to raise your awareness and provide you with resources to make your voices heard. We have invited the following legislators and organizations to speak to you today. Majority Leader Cecilia Aguiar Curry, Chair of the Aging and Long-Term Care Committee, Assemblymember Baines, and Budget Subcommittee Number 2 Chair, Assemblymember Jackson. Justice and Aging, California Association of Area Agencies on Aging, and the California Collaborative for Long-Term Services and Supports. The leadership team of the California Department of Aging and the California Budget and Policy Center. Our afternoon program focuses on 12 bills and budget asks and gives attendees an opportunity to interact with legislative staff members to learn more about issues that impact older adults. Finally, we want to acknowledge our sponsors of this annual event: the California Collaborative for Long-Term Services and Supports, the California Association of Public Authorities for IHSS, California Health Advocates, and the estate of the late Senior Assembly Member Evelyn Tom. So let's get started. Our program this morning begins with Kevin Prindiville, the Executive Director of Justice and Aging. Kevin is a nationally recognized expert on Medicare and Medicaid policy and has served as counsel in several class action lawsuits protecting low-income seniors' access to public benefits. Kevin has a long history of developing partnerships and directing strategic advocacy efforts. Finally, Kevin was a member of the Master Plan for Aging Stakeholder Advisory Committee. Welcome, Kevin.
Hello, Senior Rally Day. I'm Kevin Prindiville. I'm the Executive Director of Justice and Aging. I want to thank you for stepping out and speaking up today at Senior Rally Day and all the time. Your voices, our voices are needed now more than ever as policymakers in DC's work to make cuts to many of the programs and services that older adults, that all of us need to rely on to meet our basic needs. Republicans in Congress are working really as we speak, as we meet today. They're debating drastic cuts to the Medicaid program that would impact Medi-Cal in California and would impact services for older adults and people with disabilities. At the same time, the Trump administration has made staffing cuts and changes to services and programs at the Social Security Administration that's making it harder for people to access basic services to make sure that they're getting their Social Security payments on time and with the right amounts. While that's happening, we're also seeing funding cut to important research for older adults, research into Alzheimer's and dementia and cancer and heart disease. And while all this is happening, we've seen proposals to cut many Older Americans Act funded services that keep older people and people with disabilities at home and in the community where they want to be, where their families want them to be. This includes even programs that prevent elder fraud and elder abuse. So in this moment, we all need to be stepping up to say that these types of cuts are not okay, that these changes are not the ones that older adults need to make it easier for them to stay at home in the community, to be socially connected to family and friends and community, to have their basic needs met, like food and housing and basic supports. So we need our California lawmakers to stand up for older adults right now. They've got to be speaking out against these cuts. They've got to be ready to be sure that California protects older adults, even if the federal government starts to pull back on promises made and commitments made in the past. So, and we need you. We need you today and moving forward throughout this legislative session, throughout this budget session, to be there calling for those California lawmakers to take a stand. And today provides a great start. Thank you for doing what you're doing. Thank you for sharing your stories. Thank you for speaking up for yourselves, for your family, for your community. Because if we stand up together, if we speak up together, we can get through the challenges we're facing right now. And we can also build a better future for aging in California and across the nation. So keep it up. Thank you and have a great day.
Thank you, Kevin. I would next like to introduce Christina Mills, Executive Director, California Association of Area Agencies on Aging. Christina serves as the Executive Director, making history as the first woman to lead the organization. With more than 25 years of experience in disability rights and aging services, Christina is a passionate advocate for access, choice, and quality of life. Christina was also a member of the Master Plan for Aging Stakeholder Advisory Committee. Thank you for joining us today, Christina.
Oh, thank you so much for inviting me. It is such a privilege to be coming right after Kevin and my friends at Justice and Aging. We, like Kevin said, are living in unpredictable times. And yet it is a privilege to be here today with all of you at the California Legislative Rally, and to do so much during such a meaningful moment in history. You guys have an opportunity today and tomorrow to make a difference. This year marks the 60th anniversary of the Older Americans Act, a cornerstone of our nation's commitment to helping older adults age with dignity, independence, and choice. We all want that. Let's take a moment to recognize the generations of advocacy that have brought us to this point. The policies and programs we now rely on weren't handed to us. They were fought for by those who understood that aging in place with dignity is a right, not a luxury. And it's because of this sustained advocacy that millions of older adults today are able to live fuller, safer, and more connected lives in the community. At the California Association of Area Agencies on Aging, or C4A, we are committed to protecting and expanding the programs of older adults and the programs they rely on to remain in their homes and communities. We're also focused on strengthening the bridge between aging and disability communities, because our futures are interconnected and the people we serve often live at the intersections of both identities. As you prepare for your legislative and congressional meetings today and tomorrow, I encourage you to emphasize just how vital these programs are. Share the stories of your communities, help lawmakers understand what it takes to keep older adults not only safe, but thriving at home where they want to be. This is why we're pushing for continued investments in expanding the Aging and Disability Resource Connections, ADRCs. ADRCs are a vital part of California's No Wrong Door system, helping people of all ages and abilities and backgrounds navigate the maze, very much a maze, of long-term services and supports. They help older adults, people with disabilities, caregivers, and families make informed decisions, access services, and avoid unnecessary institutionalization. But right now, only 31 counties in California are served by an ADRC. That's not enough. I know you all know that. We need full statewide coverage, and we need the legislature's support to grow and sustain this essential infrastructure. We also know that disasters and emergencies are becoming more frequent and more severe, from wildfires and storms to heat waves and power outages. And when these events strike, it often hits older adults and people with disabilities more than other populations. It puts our people at risk. Many are displaced and end up in emergency shelters, but with access to critical services they rely on. That's why C4A is proud to sponsor AB 1069 with Assemblywoman Baines, which would allow area agencies on aging, AAAs, and ADRCs to provide services in emergency shelters. This is a practical, necessary step to ensure that when disasters strike, people aren't cut off from the programs that they need to, and they want to access to get the help they need during disaster times. Shelters would not be in the place that they are without folks like us there to help guide and protect those that need our services and care. So today, as you talk to your legislators and their staff, please help them understand what is at stake. And there's so many unknowns that I haven't brought up because they are honestly unknowns. There's all the federal unknowns, and we haven't even gotten to the May revise. I consider those unknowns as well. We are humans. We deserve to age with dignity, and this advocacy today is more important than ever. We are building a future where aging and disability services are integrated, equitable, and responsive. That's what we're doing. Where programs are not only preserved by scaled, but scaled to meet the growing needs of Californians' diverse populations. Where no one has to fight alone to stay in their home, access care, or find people in a moment of crisis. Thank you so much for doing the work you're doing. I'm excited about my legislative visits and my congressional visits, and I know that this is going to be a successful senior rally day. Thank you so much, John, and everyone for inviting C4A to participate today. Si se puede.
Thank you very much, Christina. We recognize that we had a internet issue with Christina and the voice didn't sync. We apologize for that. Our next speaker is Sarah Steenhausen, Deputy Director, Policy, Research, and Equity for the California Department of Aging. Sarah has also served as the Director of Policy and Advocacy at the SCAN Foundation. Sarah began her policy career in 2001 as a consultant to the Senate Subcommittee on Aging and Long-Term Care, after which time she served as Assistant Secretary for Long-Term Care at the California Health and Human Services Agency. Finally, Sarah was also a member of the Master Plan for Aging Stakeholder Advisory Committee. Sarah, welcome to the 2025 Senior Rally.
Well, hello, and thank you so much, John. It's wonderful to be here and to take this moment to really appreciate the wonderful work that all of you do in the California Senior Legislature and the importance of the work that you're doing today on your Senior Rally Day. So thank you again for the opportunity to be here and for all the work you do. It's really, I wanted to take a few minutes to talk about what the meaning of the Master Plan for Aging is, particularly in, as Christina was saying, these uncertain and difficult times that we find ourselves in. So just first for context, as you all may know, the Master Plan for Aging is in its 5th year of implementation. We do refresh our plan every 2 years. We update the initiatives. We do this based on the input from our 6 stakeholder advisory committees, as well as the input from our partner agencies and departments who are really committed to advancing the MPA through this whole of government approach. So we're really proud of the updated initiatives that are 81 initiatives across the 5 bold goals. And this enables us really to be more responsive to the emerging issues of the day. It doesn't mean that the work that we did in prior years for the Master Plan for Aging has been forgotten or has stopped. It just means that we are recommitting to these new set of initiatives as we plan to implement the MPA by 2030 to meet the 5 bold goals. So for today's message, I really wanted to reiterate that, we are in this difficult, uncertain time, but it's really important to consider that despite the uncertainty that we face, I'm really proud to be part of the California Health and Human Services Agency. And within that, the Master Plan for Aging that is led by our agency in partnership with the other agencies. But recently, under the leadership of California Health and Human Services Agency Secretary Johnson, the agency has recommitted to its core principles that really, I think, reflect a lot of what the values that the Master Plan for Aging is embedded in. So this is a renewed focus on equity and ensuring that we're meeting the needs of those who are most challenged in our state in terms of receiving the services they need or facing other vulnerabilities in their home and their communities. Second is to actively listen and ensure that we understand across stakeholder groups, consumers, providers, all of the individuals that are connected to our system, that we're listening to the concerns that are being brought forward. Third, committed to using data to inform our action. So again, when we think of the Master Plan for Aging, we have a data dashboard for aging that seeks to provide some transparency in terms of how we are doing in implementing the Master Plan for Aging. Fourth, we must see the needs of the whole person. So I think in days and when we think through budget issues and we get stuck in our really kind of nuanced policy discussions, it's easy to lose sight of the bigger picture, which is the need of the whole person. So we really try and think through that with everything that we're doing as we advance the Master Plan for Aging. And then finally, a key value at the Health and Human Services Agency is to cultivate a culture of innovation and always seek to build upon and improve the services that we deliver through innovation. So what does all of this mean for the Master Plan for Aging right now? Well, during these times of challenge, I understand that it can be really easy to lose hope and particularly question the value of a master plan when you might be seeing in the coming days certain programs or services or funding streams negatively impacted by either the state or the federal fiscal climate. I understand that, and it is upon all of you to continue the advocacy and the fighting that you do for these critical programs and services. But given all that, I do want to underscore that actually in these times of uncertainty, the plan is actually the most important during these turbulent times. The master plan serves as a tool and a guiding document for the state and for our stakeholders to foster communication, to elevate the needs of older adults, people with disabilities, and caregivers, to adapt to disruptions in the service delivery system, to really clarify what our goals are and where there are challenges, to reiterate what those goals are and what we need to keep looking towards. And then finally, I think that a master plan really helps us all improve our overall resiliency and in working through the difficult times that we might be facing. All of this together makes for better decision making at the state level, in the legislature, and at the local level. So what do you do now in light of the times that we're in? Well, I say continue your coordinated advocacy like you're doing. I love the alignment across aging and disability and the work that you all do and the California Collaborative for Long-Term Services and Supports and other very important stakeholder groups. And really focus on the fact that everybody is working towards the same goal. So while you may not always be on the same page as say, you know, where the administration is or where the legislature is or where your colleague is, everybody still is seeking the same goals. So we might be sitting in different positions, but we all have a very important role to play. And I would also say thinking about what your sphere of influence is versus what you can or can't control. So when you think about what you can influence, that's where you all play such a critical issue in elevating important messages to the legislature, to the administration. And then we recognize we really can't control some of the things that are out of our hands, like what's going on in the federal environment right now. Second, I would say focus on this is one of my favorite sayings, and our director, Susan DeMorris, is constantly elevating this quotation, which is from the skater Wayne Gretzky, which is to skate where the puck is going. What that really means is to be proactive and look where there actually may be opportunities. So I do want to point out that we have, for example, opportunities to invest in older adult behavioral health at the local level and through the implementation of the behavioral health transformation and Proposition 1. We, the Department of Aging, are holding a webinar on this later this morning, where we're really trying to educate stakeholders and advocates on how to get involved at the local level and what to do to fight for the funding needs of older adults in the area of behavioral health. So that's one example. Another example is through the CalAIM program, and really thinking about how older adults, people with disabilities, and caregivers can best utilize the supports and services available in CalAIM, and then where there are problems, uplifting those and communicating those messages. Finally, I think it's just important to consider that the whole is greater than the sum of its parts. So when you find yourself in difficult budget discussions and deliberations, while you may be advocating for a particular program or service, just remembering and trying to reiterate the importance of all the programs and services that are available to this population, and that each of those programs matters, so that the more that everybody can be on the same page about supporting the whole system, the better the result will be for the person. So finally, I just wanted to say, keep up the hope, your vision, and your commitment to this. And I just want to underscore our appreciation for all the work you do. So thank you for the opportunity to be here, and please reach out if you want to connect on anything.
Sarah, thank you so much for your inspiring remarks. Next, I'd like to introduce Amber Chris, Managing Director of Health Advocacy in Justice and Aging. Amber leads Justice and Aging's team of health attorneys and policy advocates in developing and implementing the team's projects and initiatives to improve equitable access to healthcare and long-term services and supports for low-income and marginalized older adults across the country. Amber is a national Medicare and Medicaid expert with a focus on programs and policies impacting people who are duly eligible for both programs. Amber recently was honored by the Missouri Lawyers Media with a 2025 Women's Justice Award. Justice and Aging is always a key player in our rally and on the forefront of aging policy advocacy. Thank you for joining us today, Amber.
Thanks, John. I'm really happy to be here with all of you today. And I'm going to be talking about the congressional threats to Medicaid coverage that would significantly harm millions of people and really erode our long-term care system. And I think, Maria, we can skip to slide 3. So I'm going to start off just with some basics before I turn to what's happening in Congress. Medi-Cal, California's Medicaid program, is absolutely essential coverage for millions of Californians. There's about 14.3 million people enrolled in Medi-Cal in the state. And 2.3 million of those people are seniors and people with disabilities. Of them, 1.75 million are people dually eligible for Medicare and Medicaid. 900,000 are using home and community-based services. Medi-Cal is paying for 2/3 of all the care provided to residents in nursing facilities. And Medi-Cal is the primary form of healthcare coverage for 50% of California's home care workers. So Medi-Cal is just absolutely essential in providing care for so many people. And what type of coverage is that? We can go to the next slide, slide 4. For around about 500,000 older adults and people with disabilities, Medi-Cal is actually the primary and only form of healthcare coverage they have, providing all of their health and long-term care needs. There's also millions more of Californians who are not yet age 65 or are not eligible for Medicare yet, may have a disability or a chronic condition that keeps them from working, but who are low income and rely on the Medi-Cal program as their primary form of healthcare coverage. And then there's those individuals who have Medicare, and Medicare is primary, but Medi-Cal is filling in those huge gaps that Medicare doesn't provide coverage for. And again, that's almost 2 million people in California. And so it's Medi-Cal, not Medicare, that is the primary payer of long-term care. That's paying for both institutional care and congregate care settings like nursing facilities. And really, Medi-Cal is the only payer of robust long-term home and community-based services. Medi-Cal also fills in other big coverage gaps in Medicare, like dental, vision, hearing, and transportation to medical appointments. And importantly, Medi-Cal makes Medicare affordable. Medicare is not free, and it's Medi-Cal that's paying those monthly premiums for people, co-pays, co-insurance, and deductibles if you have low income. Without Medi-Cal's financial assistance, people with Medicare would not have access to care. In fact, 30% of all Medicaid funding goes to support Medicare enrollees. So if we dig in a little deeper on this slide, we're looking at Medi-Cal's home and community-based services. Medi-Cal is just absolutely essential in helping older adults and disabled people age at home and in their communities. And California offers a wide array of this kind of support called Home and Community-Based Services, or HCBS. We have the in-home supportive services program, the personal care program. We have the assisted living waiver, the multi-purpose senior services program, MSP, adult day services through the community-based adult services program, the program for all-inclusive care for the elderly, or PACE, and a number of other waiver programs, and then HCBS-like benefits through managed care that's providing things called community supports and enhanced case management. Oftentimes, people don't even realize that they might be enrolled in Medi-Cal. They might just know that they're getting IHSS, for example, but it's actually Medi-Cal paying for these critical services that help people age in their homes and in their communities. So if we turn to the next slide, Medi-Cal also provides critical support to family caregivers, including that paid caregiving through things like IHSS and the waiver programs, but also respite, backup providers, adult day programs, and transportation. So Medi-Cal is supporting both older adults and people with disabilities and family caregivers. Next slide. So we know that Medi-Cal is essential for older adults and people with disabilities, and why it's definitely not perfect, and we're always seeking to improve the program, which a number of other speakers, Sarah and Christina, talked about, and Hagar Dickman from our organization will be joining later, that we're always looking for opportunities to improve the programs older adults rely on. It is really difficult to do that right now because at the federal level, Congress is proposing to make the most significant changes to the Medicaid program since its inception 60 years ago by cutting hundreds of billions of dollars from the program in order to pay for tax cuts that will overwhelmingly benefit the wealthiest and corporations. So if we turn to the next slide, the top priority when the new Congress took control this year, with majority Republicans in both the Senate and the House, was to extend and expand on the 2017 Tax Cuts and Jobs Act. The 2017 tax cuts are set to expire on December 31st at the end of this year. And so Republican leadership wants to extend those tax cuts and expand on them, as well as fund other priorities, especially immigration enforcement and defense spending. And they're using this process called budget reconciliation, if we move to the next slide. And so why are they using budget reconciliation? So this is a process that allows Congress to basically fast track or move really quickly to pass legislation with just a simple majority in the Senate, rather than the normal 60 votes that are needed to avoid a filibuster. So you only need a simple majority. And with such thin margins in both the Senate and in the House, there'd be no other path to passing the tax cuts in regular order. So the budget reconciliation process is really the only way they can move this forward. And budget reconciliation does come with some guidelines. It must actually relate to the budget. It's not, no proposal within reconciliation is supposed to add to the deficit. And there's a parliamentarian who gets to rule what is in and out of this process based on whether it's meeting those rules. Social Security cannot be cut through budget reconciliation, but notably SSI can. And to be clear, budget reconciliation has been used many times before, 23 times, in fact, by both Republicans and Democrats. Most recently, it was the Inflation Reduction Act that passed through budget reconciliation. So what does it mean for them to be using budget reconciliation? What does that look like? What's that process? So there are really 3 steps in budget reconciliation. If we go to the next slide. So the first step is that the Congress must pass a budget resolution. And that budget resolution, think of it as a blueprint, a set of instructions to specify committees in both the House and in the Senate to spend or cut spending within the committee's jurisdiction. So again, this is not a law, but instructions to committees that they must follow in drafting up the legislation to achieve the desired outcome of the budget resolution. That step is now completed. On April 10th, the House voted on the Senate's amended version of the budget resolution. And that budget resolution calls for $5.3 trillion in tax cuts to extend the 2017 tax cuts and expand on them. It also calls for $521 billion for spending on immigration enforcement and defense. So in order to pay for, because remember, it's not allowed to have a deficit, so to pay for those tax cuts and that other spending, the budget resolution has directions to the committees on where to cut spending. And notably, the committee that has jurisdiction over Medicaid, which is the Energy and Commerce Committee, has been instructed to cut at a minimum $880 billion over 10 years under their jurisdiction. And really, there's no other place to cut in energy and commerce but Medicaid. Aside from Medicare, 93% of funding in energy and commerce goes to Medicaid. So there's really no other place to cut than into Medicaid, unless they're going to go back on promises and start to cut Medicare. So we know Medicaid is in the crosshairs. We also know that SNAP is in the crosshairs, or CalFresh there in California, because the Agriculture Committee has been directed to cut $240 billion. And again, there's no really other significant place to cut than by cutting SNAP benefits. So Medicaid and SNAP are directly in the crosshairs under the budget resolution. So that takes us to step 2. That's where we are right now. This is where we've got this budget resolution agreed upon that's been passed by both the House and the Senate. The committees are drafting up legislative language to carry out those instructions that will provide trillions of dollars in tax cuts and will pay for those tax cuts by cutting public programs. So right now, the committees are doing that drafting, and they had hoped to release draft legislation this week so that the committees could mark it up. But they have been delayed at least 1 week. They have said that they're going to now release that next week because they could not agree on how to cut Medicaid specifically. There are some other disagreements, but Medicaid is really one of the key places where they're not able to come to agreement. So now they're planning on releasing that markup next week and vote it out of the committees next week, in the hopes of moving to step 3 by Memorial Day. So they want to have the full House vote on that draft legislation by Memorial Day. That deadline could slip, but this is what leadership has said is the current timeline. So this is the timeline we are all operating under because we don't want to think that they're going to slip and then they don't, and they actually move faster. So that is the deadline we're operating under. And the goal is the House votes on it, and that then the Senate would quickly vote on it and then send that legislation to the president's desk to be signed into law right around the Memorial Day or right after Memorial Day. So when we're talking about what these cuts to Medicaid could look like, if we move to the next slide, there are 2 major buckets. There is direct federal funding cuts, so that would cut funding directly to states like California through things like block grants or per capita funding that would limit the amount of money that would come to the state for different populations, or reducing the federal matching amount that the federal government pays to states. So right now, California mostly, it's a 50-50 match. California pays 50% and the federal government pays 50%. They could change that to where the federal government pays 40% and California pays 60%, or they could reduce the federal match for the expansion population from 90% that the federal government is paying to 50%. Regardless, it would reduce funding to the state of California. They could also restrict provider taxes, again, to reduce federal funding to the state of California. The second bucket is cutting enrollment or services. This is where work requirements are being proposed, or we're repealing regulations or minimum staffing ratios in the nursing facilities, or repealing other eligibility rules. Again, the idea here is to take the money from repealing those rules or imposing work requirements that would cut people off of coverage. And the savings comes from people not having their healthcare coverage any longer. So no matter what type of proposal, these are all on the table. They would all be cuts and all would harm older adults and disabled people. They are aimed at reducing federal spending for Medicaid in order to pay for those tax cuts. And Congress is not proposing some other way to help people with their healthcare coverage. This is the repeal that we saw back in 2017, but without any effort to replace. It is a total cost shift to states. And because states have to have a budget that is approved and balanced every year, states would have no way to make up that huge funding gap. So if we turn to the next slide, and what that means for California is that there is no way, if these budget cuts or if these Medicaid cuts go through, that California could maintain the same level of eligibility and benefits in its Medi-Cal program. And everyone would be impacted. Older adults, people with disabilities, their caregivers, their families, children, pregnant women, everyone. And not just individuals on the Medi-Cal program, but providers would also be impacted. So if a rural hospital closes, that's not just going to impact those who are receiving care through Medi-Cal, that impacts everybody's healthcare access. If we turn to the next slide, I want to just point out that what's at particular risk for cuts are those optional Medi-Cal benefits. And under federal law, home and community-based services are optional. And so that's our in-home supportive services, our home and community-based services waivers. All of those services I talked about that help older adults and people with disabilities age at home and in their communities. Those are optional. And so states often, and in fact, we know because they've done this before, during the Great Recession, every single state cut home and community-based services because of budget shortfalls. And California was no exception. The state reduced in-home supportive services 7% across the board. It attempted to eliminate the adult day health program. We saw that happen again at the start of the pandemic, where the state proposed to eliminate adult day health care, the multipurpose senior services program, and again reinstate those IHSS cuts. So we know that optional benefits are at risk, and home and community-based services are the most costly of those optional benefits. But we also know other optional benefits are at risk. Dental, vision, and hearing. We saw adult dental get eliminated as a result of the Great Recession, and it took decades to restore those benefits, and we're still not at utilization rates we were pre-repeal of those benefits. So those are at high risk. So are optional coverage expansions. So things like increasing the age and disabled limit up to 138%, eliminating the asset limit, coverage for immigrants, all of that is at risk. Now, I cannot tell you how California will respond to these cuts. And again, all of these cuts are currently on the table. We'll know more when we see the draft legislation, what cuts they're actually talking about. But we do know that these optional benefits are at particularly high risk. We also know that the lawmakers are coalescing around work requirements. And you might think that work requirements aren't going to harm older adults and people with disabilities, but they do. And we have a fact sheet about this in our resources, but the policy has proven to be ineffective at increasing work. So it is not it's a policy really just to reduce coverage, the number of people covered, but it actually does hurt older adults and their caregivers. So I really recommend looking at our fact sheet to understand the implication of work requirements on older adults and people with disabilities. So turning lastly to what you can do. So next slide. I think telling your story is so essential. And Christina talked about this, and it's telling your story, your family's story, and sharing that with your members of Congress directly through meetings, through letters, through making phone calls, meeting with them in district, going to town hall meetings. If you're going to DC, writing op-eds, doing media. We also recommend connecting with other groups working in coalition to fight against these cuts. And to engage in activities in your community. On the next slide, we've provided some key districts of members of Congress with high enrollment of Medi-Cal, and some of whom have concerns with cutting Medicaid funding. But to be clear, you should be talking to all of your lawmakers, regardless of party, to make clear that any proposal, no matter the type, would harm older adults and disabled people. So next slide. Our top line message is that all of these reforms to Medicaid are cuts. And there is no way to carve out older adults and people with disabilities from these harms. And these impacts impact caregivers and family members, and a cut to Medicaid is also a cut to Medicare. I would be remiss if I didn't also mention California's state budget and the uncertainty in the budget we're facing this year. The May revise will be released maybe later this week, most likely next week. And the budget had a significant gap in Medicaid funding. So we might have to advocate at the state level in the coming weeks to maintain the important services and supports for older adults and people with disabilities as these federal threats also loom. So we might be advocating at the state level at the same time we're talking about all of the reasons that federal lawmakers should not make any cuts. And as Sarah noted, the master plan is a really good blueprint and a commitment from our leadership there in California to maintain access to those essential services. So I just want to make sure that people know that that's coming. I have two plugs for some things. There's a 24-hour vigil that's happening starting tomorrow at 1 p.m. and ending on May 8th at 1 p.m. Happening at the Capitol in DC, but you can also register for live stream. I will make sure to share that link with Maria that can provide that to all of you. And then there's also a federal coalition of aging and disability advocates at both the federal and state levels. And I want to make sure you have that form to sign up if you're not already signed up for that. So I really appreciate being here and all that you're doing to protect Medicaid. To end on a positive note, in 2017, when there were efforts to repeal and replace the Affordable Care Act and make significant cuts to Medicaid, it took Congress just 10 days to pass a budget resolution. This time it took 100 days. And that's really a direct result of the work we're doing to protect and defend Medicaid every day and making sure our lawmakers understand that. And even right now, as Congress is working on that draft legislation, recent news headline said, Medicaid mucks up mega bill. And that's us collectively doing that mucking. And I've never been so proud to muck something up and to be mucking up with you all. So thank you for having me.
Amber, thank you very much for your presentation. I'd next like to introduce Assemblymember Cecilia Aguilar Curry. She's the Assembly Majority Leader. She became the Majority Leader in November 2016. In November 2016, she was elected to the California Assembly to represent the 4th District. Assemblymember Aguilar has been a strong supporter of older Californian issues, and I'm honored to be able to have the Assemblymember join us today.
Hi, everyone. Good morning. It's so great to see everyone's faces this morning. I appreciate that the theme for this year is the Senior Rally Day is empowering each of us during these difficult and challenging times. And it surely couldn't be any truer. So thank you very much. You know, some days it feels like we're reliving the early years of the pandemic and the stress and the uncertainty and the urgent needs to protect ourselves, our families, and our communities. And every day there's another blow from the Trump administration. And I can't begin to tell you how frustrating that can be. What they call is restructuring or consolidation is dismantling the vital programs, and we're only into 100 days of this. And I really question how much more we can all take, but we can do it. We need to be optimistic. The unpredictability is one of the hardest parts, and we don't know what's coming next, and that creates some fear with all of us and instability for everyone. But that's what they are banking on. That'll be frozen by fear and overwhelmed by the chaos. So many of the programs being targeted were really underfunded. We're already underfunded and struggling to meet the community's needs. So programs like Meals on Wheels are more than just food delivery. I think we'll all agree with that because they are frontline for wellness, checks for isolated seniors, and it gives an opportunity to check in on one of your neighbors with Meals on Wheels. Cutting these programs is just not wrong. It's, in my viewpoint, it's cruel. So how do we fight back? With resilience, with unity, and with vigilance, just like we did during the pandemic. Listen, let's look out for all of our neighbors. Right now, entire communities are living in fear. They're afraid to go back to school to pick up their kids or to go grocery shopping. Well, we're here today because we believe in dignity, I believe in fairness, and we believe in respect for every person, especially the most vulnerable. The days and years ahead of us are going to be rough, and we must stretch every dollar and every partnership to protect the programs that we are working on. So let's keep raising our voices. We've got to do that. Tell your elected officials what you're seeing, what's working, what's failing, and what's still needed. Tell your stories. Everybody wants to hear a story, and they can relate to your stories. I can throw numbers out to you today, but let's be quite honest. They want to hear the story. We got to keep raising our voices every day. But despite all this uncertainty, we must continue past the chaos and fear and implement the master plan for aging. We've made real progress, and we can't afford to lose ground. So I'm personally working on legislation to strengthen transparency, accountability, and consumer protection for older adults. One key issue is long care staffing. As more people go into assisted living, we must address the critical shortage of direct care workers. Unlike skilled nursing facilities, assisted living facilities currently have no mandated staff to resident ratios or reporting requirements. My bill, AB 508, will require residential care facilities for the elderly to disclose their daily staffing so families can make sure they're making informed choices. This bill did come around from one of my very dear friends whose mother went into a facility and they didn't understand the staffed to resident ratios. And unfortunately, it was harmful to her and to their family. I'm also advancing AB 280, which would require health plans to maintain accurate, updated directories so people seeking mental health or healthcare services can find real help, not dead ends. We find dead ends all the time when you're trying to find your provider or a good doctor that you want to work with. So today, my only ask is this: keep doing the work you're doing. Keep doing your incredible work. Stay engaged, stay vocal, continue driving the aging conversation forward. I will be the first to admit that I'm 70. I'll be here for 4 more years, and I really want a lot of this taken care of, so quite frankly, that I can take care of myself. So your expertise and advocacy is essential to everything we do in the legislature. I want to thank you for your tireless support and for the opportunity to be here today together. And when I say together, every one of you on the call, plus your friends and your neighbors and your family, we will need to continue to stand strong for our older adults in California and, quite frankly, throughout the nation. I thank you very much for having me today, and continue the great work that you all are doing.
Thank you, Majority Leader. Appreciate your remarks. Next on our agenda is Assemblymember Baines, Chair, Aging and Long-Term Care Committee. Due to unforeseeable circumstances, Assemblymember Baines is not able to join us today. She sends her heartfelt regrets and wishes everyone a successful conference. Next on our agenda is Maria Kalina, Executive Director, California Collaborative for Long-Term Services and Supports. Maria, welcome to the 2025 Senior Rally, and thank you for the Collaborative's ongoing support and involvement in the rally.
Thank you so much, John. Good morning, senior legislators. Good morning, colleagues and friends. It's really an honor to be here today along so many talented advocates who, for decades, have shown that wisdom, experience, and civic engagement only grow stronger with age. You are all champions for your communities, and I want to express my deepest thanks for your commitment and tireless work on behalf of older Californians. This year's Senior Rally Day theme, Empowering Aging Californians During Challenging Times, captures the urgency and the complexity of the moment that we face. And as Kevin noted, and so many other speakers noted in the remarks today, we are witnessing a historic effort to dismantle the safety net programs and foundational public commitments that have long supported older adults, people with disabilities, and caregivers. Public health, housing, nutrition, social security, and civil rights protections are under threat, targeted by proposals that are not only harmful, but incredibly short-sighted. So while California has led the way with bold efforts like the Master Plan for Aging, our progress remains deeply intertwined with federal policy. And at a time when need is growing, we're seeing the federal government take a step back rather than step up. And as Amber highlighted, Medicaid is a really clear example of that. And I know the California Collaborative is going to be sharing this message out as well. But proposals to cap Medicaid or to impose new administrative barriers like work requirements are gaining traction. They're being discussed in Washington as we speak. And while these proposals are often framed as efforts to ensure long-term stability, research and real-world experience tell a very different story. These strategies do not improve efficiency or outcomes. So we have to stop this narrative. Per capita caps, federal match reductions, limit federal Medicaid funding regardless of the actual need, and that forces states to make very difficult choices. And because home and community-based services, or HCBS, are optional under federal law, they are particularly vulnerable to budget cuts. So even when federal cuts are not aimed directly at older or disabled adults, the financial burden on states often results in reductions or eliminations of these programs. And as Amber mentioned, historical precedent confirms this risk. During prior federal Medicaid shortfalls, every state, including California, reduced support for HCBS despite recognizing their value. And these cuts don't curtail spending. They instead shift those costs elsewhere. So leading to more emergency room visits, more hospital stays, more unnecessary institutionalization, which places further strain on an already stretched system of care. And the challenges go beyond Medicaid. We're seeing sweeping efforts to scale back core safety net programs like SNAP, housing supports, and even Social Security programs that millions of people on fixed incomes depend on to live with stability and dignity. And these threats aren't theoretical. They're already taking form. We've seen the closure of Social Security field offices. We've seen reductions in federal agency staffing and administrative rules that make it harder, not easier, for people to access what they're eligible for and entitled to. So this moment demands more than concern. It demands action. Tomorrow, members of the California Collaborative will be meeting with both congressional and state elected officials to elevate these issues and to urge leadership at every level of government to defend and strengthen the systems of care that allow people to age at home, to stay connected with their communities, and to live with independence and dignity. But this work, this monumental work, doesn't just fall on one group. It really does belong to all of us. Each one of you here today has a role to play in protecting the future we're working so hard to build. We know from experience that when formal supports are weakened, the burden falls on families and communities. It falls on broader healthcare systems that are already stretched thin, and ultimately on state budgets as preventable crises turn into costly interventions. It doesn't have to be this way. We have the tools, we have the knowledge, we have the leadership to build a system that works, one that is both fiscally responsible and person-centered. Because when older adults, people with disabilities, and caregivers are left out of the conversation, the consequences ripple through every part of society. So this is the time. This is the time to strengthen partnerships, to share those stories, to make sure that every lawmaker, regardless of the party, understands what is at stake. These are not partisan issues, they're human issues. So I just want to leave you with this. The future of aging in California and across the country depends on what we do today and tomorrow and the day after, on how we speak, on how we organize, and and how we work to protect the systems that uphold our values. So this is not the time to sit back and remain silent. This isn't the time to look around and wait for others to step forward and lead the charge. Every one of us here has to be that leader. So I encourage you to get involved, join a coalition, call your representative, meet with elected officials, mentor new advocates, elevate the voices of people who are too often unheard, show up and keep showing up. Because when you do, you're not just influencing policy, you're shaping a legacy, one rooted in dignity, inclusion, and the belief that aging should be celebrated, not ignored, not feared, and certainly not left out. So thanks again for all the work that you do, and I will pass it back to John.
Maria, thank you so much. I'd next like to introduce Susan Damaris, Director, California Department of Aging. Susan was appointed by Governor Gavin Newsom to serve as director effective November 1st, 2021. Prior to joining CDA, Director Damaris led public policy and advocacy for the National Alzheimer's Association in California. Susan has also served as an appointee to Governor Newsom's Alzheimer's Prevention and Preparedness Task Force, in addition to being a member of the Master Plan for Aging Stakeholder Advisory Committee. Susan, thank you for taking time out of your busy schedule to join us at the rally today.
John, thank you so much. I am so happy to be here. And wow, Maria, you put the rally in Senior Rally. That was very inspiring to hear your remarks. And I give you one of these to follow you. My goal today in joining you is first and foremost to thank all of you, each of you individually and collectively, exactly as you just heard. We are living in uncertain and interesting times, and I want to thank you all for your advocacy, for your organizing, for exchanging information, for tracking down and chasing rumors. I could not be more proud of California and how we're rising and responding to the situation that we find ourselves in today. So thank you all. And, when we heard from the former Administration for Community Living Administrator and Secretary Allison Barkoff, who is advising aging and disability networks around the country, she said, work together in coalition, avoid singular issues, come together. And I thought that's what California does best. And that's already happening now. And today is just further proof and evidence of that. I could not be more proud of our state and how we're mobilizing as a collective. So thank you. Please feel free always to share things that you think I need to know about, or the Department of Aging needs to know about, or the Health and Human Services Agency or the administration, because things are moving fast and furious. And I know that many of you joining today, some of you are part of national organizations that have a strong footprint in Washington, D.C. You may hear things first before any of us do. So thank you. I do want a cautionary note. These are serious times, but much of what we have seen and heard is still draft, is still proposed, stems from leaked memos and may be subject to change. So part of the difficulty today is really assessing what it is that we need to lock in behind and what we need to give some time to. So I know that the federal threats are looming large. I know the reductions in force at the U.S. Health and Human Services Department have widespread consequences, well beyond the Administration for Community Living, the Centers for Medicare and Medicaid Services, VA, and other programs, CDC, Centers for Disease Control. You may have seen that California State Attorney General issued a notice yesterday where California is joining forces with other states to challenge those reductions in force. In terms of the dismantling of the Administration for Community Living, just yesterday, the Health and Human Services Department issued a press release, and they confirmed that funds are flowing to states to support the Older Americans Act, that we expect to receive our funding through the continuing resolution by the middle of this month. So those dollars are flowing. and our local partners will be receiving their funding. We've seen some programs, some beloved and critical and essential programs have been slated for elimination. As a reminder, those haven't yet happened, and we're just commencing the federal budget process now this May for the next fiscal year. And we've heard lots of talk about cuts. Again, the federal budget process is just beginning. So, stick together, stand together, and keep sharing information with one another and with this administration. I know also as you meet with legislators as part of the Senior Rally Day, the governor's May budget revision is also something that we're all concerned about. And we're about 10 days out or so from that, just under 2 weeks from knowing what will happen there. And this is an ecosystem that we live in, that it is very clear. Our counties are facing, our cities and counties are facing fiscal challenges now. Our state is facing fiscal challenges. And then there are these federal threats looming. So I just want to acknowledge this is a very difficult time. I want to channel Dr. Corey Jackson, who I see will be presenting to you later. And he shared something in our budget hearing where he said, sometimes the times choose you. And this is one of those times where I think we've all been chosen to work together in these challenging times. And I think we can point to California's master plan for aging as an example where when Californians come together, when we bridge the aging and disability gap, and when we stand together in unison for the populations who are most vulnerable, who are most at risk, who are underserved, marginalized, that's when we all rise. So thank you for including me today in your agenda. I wish you a wonderful day and success with your advocacy visits. And I'm here for you. CDA is here for you. And I know you'll be hearing from other representatives of our staff shortly. I wish you a very successful event and day.
Susan, thank you so much for your leadership. Next, I would like to introduce Nicole Simasaka, Deputy Director, Administration, California Department of Aging. Nicole serves as the Deputy Director. She joined CDA in 2018 and has played a key role in implementing several initiatives under the Master Plan for Aging and has been a leading contributor to the department's strategic planning efforts. Nicole oversees budgeting, resource allocation, and operational growth, supporting the department's expanding mission and priorities. Nicole, thank you for joining us today.
Thank you for having me today. Very happy to be here. I did do a PowerPoint presentation so that we can review the budget of where we're at today and where we plan to go in the near future. Of course, I caveat this with there's lots of things going on and changing at the federal level. This is what we know to be true today, and this is where our budget stands. So we'll continue to definitely work very, very closely with all aging partners as we better understand the administration's priorities and exactly where we're going with the budget. But I have created a PowerPoint today so we can walk through this together. Next, thank you. As a state unit on aging, the California Department of Aging administers programs under the Older American Act and Older Californians Act, programs that many of you are very familiar with. These services support the well-being of older adults, people with disabilities, and caregivers, which include nutrition, legal assistance, transportation, in-home services, and caregiver support. We receive approximately $244 million each year in state and federal funds in direct support of the Older American Act's programs. As we plan ahead, we remain focused on what matters most, ensuring equity, expanding access, and promoting dignity for every older Californian. Next slide, please. One of the biggest areas of investment is nutrition for our department. 68% of Older American Act funding goes straight into meal services, making it the single largest funding category for the department. Since 2020, CDA has received an increase of $52 million annually in general fund for nutrition services. This has helped deliver over 2 million more meals each year, as it has also helped local agencies cover the rising cost of food, staffing, and delivery costs so they can keep serving more people. Next slide, please. And one more. The supportive services comes next, which accounts for about 15% of our funding. This includes vital programs like transportation, case management, and legal assistance. There's actually about 30 different allowable activities under supportive services, and it's local autonomy dictates where those efforts are focused. One more. Lastly, we were very fortunate to have received an installment of funding as COVID has ramped down and ramped out. The legislature approved a one-time investment of $186 million, which would help the local area agencies on aging keep up with the COVID era demands. As many of you are aware, we were very concerned with the nutrition cliff, where we were at an all-time high with COVID funds, and we were fearful of what it would mean when those funds ceased. So this investment is helping with a slow ramp down so that there's to mitigate harm done across the network as we reach more baseline service levels. This $186 million investment is focused on supportive services and nutrition, and this funding is currently in the field and it will continue to run through 27-28. Next slide, please. As many of you are aware, there is an unmet need that we continue to remain focused and committed to. A 2021 study that was commissioned by California Association for Area Agencies on Aging found that millions of meals are still out of reach for low-income older adults, an estimated 370 million in unmet need annually. On top of that, we continue to hear from communities about the need for rural nutrition access, culturally appropriate meals, and emergency preparedness during disasters. Further, we are also aware of the volunteer declines. Between 2020 and 2024, we saw a 51% drop in ombudsmen and a 20% drop in high-cap volunteers. In response, we are preparing to launch a statewide ombudsman recruitment campaign this July, which will run through December 25, and we'll soon share recommendations to help it strengthen high-cap staffing as well. As you also know, caregiver respite is in high demand, and we continue to remain focused on meeting that need as well. Last slide, please. And as we look ahead, we continue to be focused on building a future-ready aging network. Many of you are probably familiar with the CA 2030 initiative, which closely aligns with Senate Bill 1249. We are working to improve the consistency and quality of services across 3 key areas: nutrition, supportive services, and caregiving. We are developing performance metrics and reviewing how we allocate funds across the state so resources go where they're needed most. We're also reviewing the intrastate funding formula, which is what dictates how Older American Act dollars are allocated across the state of California. The goal is to make sure resources are reaching the communities that need them most. Throughout all of this work, we're staying closely connected with our partners who continue to deliver services on the ground every day. And I truly thank all of you for the work that you do and your continued advocacy. Your voices are helping to shape a stronger, more equitable future for all Californians. And I appreciate you having me here today. Thank you.
Nicole, thank you very much. I would next like to introduce Assemblymember Corey Jackson, Chair, Budget Subcommittee, Number 2, Human Services. Assemblymember Jackson was elected in November 2022 to represent the 60th Assembly District. In 2023, he chaired the Human Services Committee and currently serves as the chair of the Budget Subcommittee, Number 2 on Human Services. Assemblymember Jackson, thank you for joining us today.
Hello, this is Assemblymember Dr. Corey Jackson, and I proudly represent the 60th Assembly District. It is an honor to join the 2025 Senior Rally Day and stand in solidarity with our seniors. I want to thank the California Senior Legislature for the invitation and for your continued leadership in advocating for the rights, dignity, and well-being of our aging population. This year's theme, Empowering Aging Californians, during challenging times. It really speaks to the moment we are living in. Our seniors deserve more than just recognition. They deserve real investments. They deserve responsible policies and a budget that prioritizes their needs. So whether it's access to health care, housing, food, or in-home supportive services, the decisions that we make today must be rooted in the equity and compassion of our seniors who have given us so much. Last year, I spoke about my commitment to uplifting the voices of older adults, and that commitment remains stronger than ever. Together, we must ensure that our budget reflects the respect we have for those who have paved the way before us. So thank you again for the opportunity to be a part of this year's Senior Rally Day, and I look forward to working with you all to create a California where every senior can age with dignity, safety, and purpose.
Excuse me, technical difficulty. I would like to introduce Adriana Ramos Yamamoto, Policy Analyst, California Budget and Policy Center. Adriana conducts research and analysis on policies affecting access to health care services and health equity in California. She is dedicated to advancing solutions that create a more equitable health system, ensuring all Californians can access the care they need to be healthy and thrive. Excuse me, Adriana. Excuse me, Adriana, thank you for joining us.
Thank you for having me. Hope you're well, John. And no worries, technical difficulties happen to me as well. Today, I'm going to talk about some of the federal budget threats that we're seeing from Republican-controlled Congress and the Trump administration, and the implications to our state budget and to seniors in our state. And just in case you're not familiar with our organization, the California Budget and Policy Center, we are a research and analysis nonprofit. We do research and analysis around the state budget and state policies with the overall goal of advancing public policies that improve the lives of Californians with low incomes. So with that, we'll jump right in. I'm sure you all have been following news at the federal level. We've seen Republicans in Congress propose really radical and damaging funding cuts that would propose risks to the economy, revenue outlook, and Californians' health and well-being. And these cuts that have been proposed would devastate vital programs in our state, including Medi-Cal, our state's Medicaid program, and CalFresh, all in favor of extending tax breaks that disproportionately benefit corporations and wealthy individuals. And I'm sure we all know why this matters. Well, federal funding provides major support for key programs and services in California, as we'll see on this next slide here. If you take a look at the proposed expenditures for this upcoming fiscal year, which is around $492 billion, we have a big state budget. You can see that federal funds make up over 1/3 of our state budget. That's about $170 billion in federal funds that support critical public services and systems in our state. Moving on to the next slide. Now, if you take a look at these federal funds, you'll see that Medi-Cal relies pretty heavily on federal funding. Nearly 2/3 of Medi-Cal funding comes from the federal government because Medi-Cal is primarily funded by the federal and state government. And so cuts to federal funding for Medicaid could really profoundly impact the nearly 15 million Californians in our state who are enrolled in the program, with many potentially losing their coverage if these cuts move forward. And if we take a look at CalFresh, we know that federal funds support around 99% of food assistance benefits in California. And over 5 million Californians who rely on CalFresh would potentially be at risk of losing their benefits and experiencing food insecurity if federal funding is cut. And that would put an impossible strain on local food banks. So let's talk a little bit more about what the exact threats are to Medi-Cal and to CalFresh. Starting with Medi-Cal, there are many cuts that have been considered. There are many different ways that Republicans could make cuts to Medicaid. And I should note that we don't know what the exact details are at the moment. We'll be finding out maybe in the next several weeks what these cuts are going to look like, but these are just the cuts that have been considered. One includes imposing burdensome work requirements in Medicaid, and more than 50% of Medi-Cal enrollees would be at risk of losing coverage if this were to be imposed. Republicans could also replace Medicaid's financing system with a per capita cap that would essentially limit federal funding support for the program. They could also end the enhanced federal matching rate that applies to the Affordable Care Act Medicaid expansion, which California implemented in 2014, and a lot of adults were able to access Medicaid as a result of this policy change. They could also reduce the standard federal matching rate below the current floor, which is about 50%. That currently applies to our state. And lastly, they could restrict the use of provider taxes, which brings billions of additional federal Medicaid funds to California every year. And just to kind of put these cuts into dollar amounts, what these cuts would essentially do was it would shift costs to our state. And depending on what they do and the size of the cuts, it could shift $10 billion to $20 billion or even more in new annual costs to our state. So some examples here: $12.5 billion. That's the additional cost just in the first year to maintain the 2014 Medicaid expansion if Congress decides to reduce the 90% enhanced federal matching rate for that population. Another example, $10.6 billion. That's the additional cost, again, in the first year in order to replace the federal funds that are lost if Congress decides to reduce the minimum standard matching rate from 50% to 40%. The key takeaway here is that millions of Californians would be at risk of losing their healthcare coverage, even if state leaders manage to partially replace lost federal funds with state revenue. And we know that threats to Medi-Cal are threats to seniors. Medi-Cal is a lifeline for seniors. 2.3 million Medi-Cal recipients are older adults and people with disabilities. 1.6 million people in California are actually dually eligible for Medicare and Medi-Cal. So even if Republicans in Congress are saying they don't want to touch Medicare, well, if they cut Medi-Cal, it would still impact seniors. Because Medi-Cal makes Medicare more affordable for older adults and people with disabilities by helping to pay for the premiums and out-of-pocket costs. And now shifting over to CalFresh, we know that threats to CalFresh are also threats to seniors. Seniors as you can see in this chart, seniors now make up over 1 in 5 CalFresh participants. And this increase in participation is not necessarily a bad thing. You can look at key eligibility expansions, including the 2019 expansion to extend benefits to Social Security recipients that has made the program easier to access for seniors who need help putting food on the table. However, this increase in participation really does underscore how important the program is for seniors in our communities. So similar to Medicaid, there are many SNAP cuts that are being considered. These include a pass the buck, so to speak, proposal that would require states to pay a portion of SNAP costs, which currently, as we saw earlier, are almost fully covered by federal dollars. They could also impose time limits on assistance for exempted populations like veterans, people experiencing homelessness, youth who aged out of foster care, and older adults ages 55 to 64. Republicans have also considered rolling back expansions to the Thrifty Food Plan, which would decrease the already limited benefits and make it harder for families to afford groceries. And another proposal that I want to highlight is one that would end broad-based categorical eligibility, which would create significant administrative burdens and take food away from children who receive school meals. And once again, should note that these aren't necessarily exact. Again, we'll find out the details of the exact proposals and the exact cuts that they want to make to programs and the exact amounts over the next several weeks as Republicans in Congress continue the budget reconciliation process. Now, moving on to the next slide, I also want to highlight how these cuts to SNAP could shift costs to California that are really insurmountable. We have recently learned of a proposal that would require states to pay for 22.5% of SNAP benefits. And if this proposal is implemented, this would mean inevitable cuts for SNAP benefits because the state budget at this time would not be able to absorb the cost. So as an example, to fund 10% of CalFresh benefits at the state level, California would have to pay $1.2 billion. This jumps to $3.1 billion if the state is required to pay 25% of benefits. So just to kind of put that into perspective. SNAP benefits has been almost entirely funded by the federal government since its inception. The state has always helped to pay for administrative costs. And so a shift of this magnitude would force state leaders to make really tough decisions about how to provide the funding that would be necessary in order to mitigate the cuts that would impact people's access to food assistance. Next slide. So with these looming federal threats, we've really been urging state leaders to protect state-funded food assistance programs along with fighting the cuts. That has really been a top priority for advocates in the food assistance space. In particular, the California Food Assistance Program expansion that will provide food assistance to older adults regardless of immigration status is set to start in 2027. And given that this implementation has already been delayed, it'll be important for state legislators to recommit to this expansion that is so valuable for many in our community. Additionally, expanded funding for CalFood, which is the program that provides food banks with money to purchase food from local growers, will expire later this year, and the program's budget will decrease from $60 million to $8 million per year. And food banks are an integral part of the fight against hunger, and the potential cuts to CalFresh will only make them more valuable. I want to highlight a couple of other potential threats that may impact seniors. If we can go on to the next slide. So these are some additional cuts that would compound the harm that I've been sharing throughout this presentation. So some of the cuts that are actually already underway include staffing cuts and other actions from DOGE that jeopardize seniors' ability to access Social Security benefits, as well as the elimination of the Administration for Community Living that could hinder critical program administration, including adult day programs and transportation services. And some cuts that have been proposed include eliminating the social services block grant, which would weaken Meals on Wheels and adult protective services, as well as implementing more red tape for income and asset verification that could push people off of SSI. And lastly, cuts to housing support programs would harm older adults who make up 40% of those who are experiencing homelessness. And I know I've emphasized and stressed a lot about these cuts and these potential cuts that we're seeing Republicans in Congress and the Trump administration actively support. But I do just want to end on a little bit of a more optimistic note, which is that these cuts are not inevitable. We still have time to push back on federal policymakers, and there will also be an opportunity if these cuts do move forward through the budget reconciliation process, there will be an opportunity for state leaders to respond and advocacy opportunities to ensure that state leaders do everything that they can in order to mitigate the cuts at the federal level and safeguard access to health and nutrition benefits. Thank you so much for having me today.
Adriana, thank you for joining us today. This concludes the AEM portion of our program. In my opening remarks, I stated that our goal was to raise your awareness of the status of key programs at the federal and state levels and provide you with resources to make your voice heard. I hope we achieved this today with today's rally. I would like to thank our presenters as well as those that attended. After a few announcements, we'll break for lunch. During the lunch break, take the opportunity to revisit the lobby to view legislator messages as well as the exhibitors and sponsors. A special thank you to our sponsors and exhibitors that make this event possible. Let me close with some comments about the advocacy program. The advocacy program will run from 1 to 3 p.m. This portion of the program brings legislators or their representatives together with senior rally participants and gives attendees an opportunity to learn more about 12 bills and budget asks that directly impact the lives of older Californians. The advocacy program schedule can be found in the materials tab on the toolbar of the senior rally lobby room. The document identifies the legislation and budget issues that will be covered during the advocacy portion of the program. Feel free to print it out and bring it when you join the program this afternoon. At 12:45, navigate to the Advocacy Meeting tab on the toolbar on the main lobby page. Click the link in the center of the page and it will take you to the advocacy program. Thank you for joining us today. Together, we can make a difference during these challenging times.